Good morning. Thanks to the organizers for inviting us to present again, and I look forward to sharing a bit of an update about Annexon's activities, both in and outside the ophthalmology space. I'm Scott Borland. I lead the ophthalmology franchise and look forward to growing that franchise as the years and months and years go by. We're a public company. We'll be making some forward-looking statements today. As somebody said earlier, there'll be a quiz on that later. So Annexon Biosciences is really focused on advancing what we love to say are game-changing therapies. And we're really focused on inhibition of C1q. We have a very broad strategic pipeline across several disease areas, including autoimmune, neurodegeneration, and ophthalmology. We're really driven by an expert and really diverse team, and we have multiple clinical outcomes coming over the next 18 months across those three disease areas. Again, we're really focused on inhibition of C1q, and we really see this as an on-off switch for the classical complement cascade. And this enables us to block all of the downstream activities, not just the peptides, but also cell attack, inflammation, and so on. And so we hope that this is a mechanism for preserving normal function where aberrant activity has taken place. And we really like the idea of the anti-C1q approach in that it really heads off the entire cascade and other associated activities. The C3, C5 approach has been presented here earlier, and we think there's a lot of value in that, but there's still some bypass activity that can happen, and importantly, that inflammation and cellular attack sometimes cannot be avoided with that sort of an attack, so we really like this approach. This is really being focused in several disease areas, as I said. We have a phase 2-3 study going on in Guillain-Barré syndrome. We just released data a month or so ago in Huntington's disease, which really showed some truly landmark results there, again with a focus on C1q inhibition. And then, of course, our geographic atrophy study focusing on C1q there as well. So this pictorial shows the pipeline at Annexon, a lot of activity happening in the next 18 months, starting with first-in-human studies in a number of novel compounds, but also getting into phase 2 efficacy and phase 2-3 pivotal study work across a variety of areas. With respect to the ophthalmology space in particular, ANX07 is our lead compound. It is a monoclonal antibody Fab fragment designed specifically for IVT administration and allows for localized inhibition of C1q in that space. And this graphic shows the presence of C1q in a diseased human GA retina. At the top, you see the sort of grayed pictorial that is representative of C1q. We see in the middle graphic presynaptic and postsynaptic binding, and then when we combine those together, we see that the C1q is located on those synapses. So it tells us it's truly in that location in the human GA retina. This slide shows some data from an animal model, specifically the light damage model. On the left, you see the naive animal, and just to the right of that, you see the effects of the light damage affects themselves with the presence of the C1q green material showing up. And importantly, the inhibition of C1q allows us to maintain both structure and function in this model, and we think that's representative of what we'll see in the human patient. And then, in an earlier phase 1 study, this happened to be in a glaucoma population. We showed we were able to fully inhibit C1q in the human eye. This study was very successful. We showed that inhibition at up to 29 days, and it was very well tolerated through the study. And in the graphic on the right, you see that inhibition at both dose levels all the way through the 29-day period. So that brings me to the phase 2 Archer study that's in progress now. You may have seen that we closed enrollment to this study back in March. It's a 12-month study across 270 patients. We'll follow those patients through the course of the upcoming year and look forward to coming back to this group soon with some data out of that study that really leverages that C1q inhibition approach. That's what I have for today. Thank you very much for your time and attention.